Main stories.
Failing our most vulnerable, there's fury as elderly people with severe dementia face being evicted from their care home.
All these people at Birch Avenue, the professional people, to move out of that environment into an environment where you haven't got them type of people. It won't be fair on theirs.
A city divided 17 years after Bradford was devastated by riots. The government says communities there are still leading separate lives.
I didn't have any hesitation in saying yes because that was the natural next step.
A match made in jail. What leads someone to marry a convicted American killer who's serving 75 years behind bars?
Like a brain power.
And talk of the town. We caught up with Keira Knightley on the set of her latest Hollywood blockbuster in Boston Spa. But first, they are among the most vulnerable members of our society, elderly people with severe dementia who no longer recognise their loved ones and who rely on round-the-clock support in specialist care homes to meet their most basic of needs.
But tonight in Sheffield, there's a furious backlash after the local NHS decided a group of patients like this should be evicted from their care home where they've lived for years.
Well, health chiefs insist the patients no longer need the level of care that they've been getting, but their families moving their loved ones say could ultimately lead to their early deaths. Well, John Hill has been speaking to Alf Rhodes about his wife Hazel.
Hazel, like a good lad. She was full of fun. She was like dancing. When we got married, she enjoyed looking after her children. All round, as she said, she was a perfect woman. In my eyes.
And now?
Now she's an invalid, isn't she, now?
For 83-year-old Alf Rhodes, the last few years have brought only heartache. Now he's been thrown into turmoil. 10 years ago, his wife Hazel was diagnosed with dementia. She was just 63. 4 years ago, she moved into this specialist NHS-funded care home in Birch Avenue in Sheffield. But now, after a new assessment of her needs, the NHS has told Alf they'll no longer pay for Hazel's care and she must leave the home.
What's your worry, Alf? What will become of Hazel if she's forced to leave the Birch Avenue?
Well, she'll deteriorate and that way at the end of Hazel.
Across Sheffield, there's been a backlog in the number of assessments being carried out on people living in care homes. But now the powers that be are catching up with that backlog. It means that the case of Hazel and Alf is far from unique. In fact, 8 people living here at Birch Avenue, 8 people with dementia out of a total of 40, have now been told they'll have to move out because the care provided here simply isn't right for them.
Health bosses say that as a patient's dementia gets worse, it can mean they no longer need the enhanced nursing care provided in a home like Birch Avenue. But patients' families feel they're the victims of cost-cutting by the local NHS body, the Sheffield Clinical Commissioning Group.
Whatever's happened, this is cack-handed. You can't have elderly people whose loved ones are vulnerable and have severe dementia. You can't have them put under this stress, and that's what's happened.
Right. So in respect of that, this care home is no different from any other in the city. It's no different from any other care home nationally. What's been done differently is we've actually caught up on some of those reviews, which means these patients will move. But genuinely, CHC assessments take place throughout Sheffield. Patients' needs change, funding needs change. Some patients become, if it's financially appropriate, would have to be self-funding.
The NHS insists the decision to move Hazel and some of her fellow patients has nothing to do with cost-cutting. But for Alf, the uncertainty and the sense of injustice goes on.
My wife worked all her married life. She paid full stamps. I pay my full stamps. When you pay into an insurance, you expect the benefits of it when you need it. But it's not there, is it? Not for my wife, it's in January.
Alf Rhodes there speaking to John Hill. Well, a little earlier I spoke to Angela Smith, the MP for Penistone and Stocksbridge, and I started by asking her what she makes of this situation.
Well, I'm astonished and appalled. We have been messed about by the CCG now over a very long period of time. They started by saying they wanted to look at how to run Birch Avenue Nursing Home differently. Then they moved on to say, no, we're not doing that anymore. We're doing a strategic review of how dementia services are run across Sheffield. And the next thing we know, they're telling some of the residents at the home that there's no longer any money for them and that they've got to move out of the home.
And the families also don't know what's going on, which just makes things so distressing.
My father died of dementia last year. My uncle died only 3 months ago of dementia. So I do understand entirely how important it is for patients, residents and residents' families to know what's happening, to have certainty. People with dementia do not adapt to change very quickly or very easily. And I am really very concerned. I mean, if the CCG has done its review and decided it wants to do things differently, then why haven't they told people about it? And why haven't they accepted the advice they were given by local politicians that it's always best to transition these things and not to disturb people living under current arrangements? You know, we're talking about some of the most vulnerable residents in nursing homes, in residential homes, in the residential home sector. And I'm working with some of the relatives, and they are in despair at what's happening, and in despair because they worry about the impact of all of this on their loved ones.
Where are you going to take this forward from here?
So we need to meet with the CCG on Friday. We also want to talk to the council to get an understanding of what's going on at that level in terms of social care funding. And patients' relatives will be joining us on Friday as well. So let's see where we go from there.
Okay, that's all the time for. But Angela Smith, thank you very much for your time.
Thank you.
Well, next tonight, to the Deep Division.